Nicotine addiction is a complex and pervasive issue that has significant health implications for individuals across the globe. Nicotine, a highly addictive substance found in tobacco products, has been a central factor in the widespread use of cigarettes and other tobacco-related products. This comprehensive exploration delves into the various facets of nicotine addiction, including its chemical properties, physiological effects, social and psychological factors, health consequences, and strategies for prevention and cessation. Let's get into the chemistry of nicotine, unraveling the addictive molecule. Nicotine is a naturally occurring alkaloid with a chemical structure comprising nitrogen and a bicyclic ring system. This structure plays a pivotal role in its ability to bind to specific receptors in the brain, leading to its addictive nature. Upon inhalation or ingestion, nicotine rapidly crosses the blood-brain barrier. Once in the brain, it interacts with nicotinic acetylcholine receptors, initiating the release of neurotransmitters such as dopamine. This process creates a rewarding sensation, reinforcing the desire to consume nicotine. Dopamine, often referred to as the feel-good neurotransmitter, plays a crucial role in the brain's reward system. Nicotine's influence on dopaminergic pathways contributes to the development of dependence and addiction. Physiological effects of nicotine, beyond pleasure and reward. Nicotine exerts both stimulant and relaxant effects. Users often experience increased heart rate, elevated blood pressure, and a sense of alertness and focus. These effects contribute to the initial allure of nicotine-containing products. With continued use, individuals develop tolerance, requiring higher doses of nicotine to achieve the same effects. Dependence follows, characterized by cravings, withdrawal symptoms, and a diminished ability to control or stop nicotine intake. Nicotine withdrawal can be challenging, with symptoms ranging from irritability and anxiety to difficulty concentrating and increased appetite. These symptoms contribute to the cycle of dependence, as individuals may be motivated to continue using nicotine to alleviate discomfort. Social factors, including peer pressure and cultural norms, significantly influence nicotine use. The portrayal of smoking in media and the presence of smokers in one's social circle can contribute to initiation and continued use. Individuals with certain personality traits, such as impulsivity or a propensity for risk-taking, may be more susceptible to nicotine addiction. Additionally, mental health conditions, such as depression and anxiety, can increase the likelihood of developing dependence. Nicotine use often serves as a gateway to the use of other substances. The association between smoking and subsequent illicit drug use highlights the need for comprehensive prevention efforts targeting multiple forms of substance abuse. Health consequences of nicotine addiction beyond the lure of pleasure. Smoking is a leading cause of respiratory illnesses, including chronic obstructive pulmonary disease, COPD, and lung cancer. The inhalation of tobacco smoke exposes the lungs to harmful chemicals, leading to long-term damage. Nicotine contributes to cardiovascular diseases by increasing heart rate and blood pressure. The constriction of blood vessels and the formation of arterial plaques elevate the risk of heart attacks and strokes among long-term smokers. Nicotine use during pregnancy poses serious risks to fetal development, increasing the likelihood of premature birth, low birth weight, and developmental issues. Exposure to secondhand smoke also presents risks for infants and young children. Smokeless tobacco products such as chewing tobacco and snuff can lead to oral health problems, including gum disease, tooth loss, and an increased risk of oral cancers. The use of tobacco in any form poses a threat to oral well-being. Prevention and cessation, breaking the cycle of addiction. Education and awareness campaigns are crucial components of public health efforts to prevent nicotine addiction. These initiatives aim to inform individuals about the risks associated with nicotine use and empower them to make informed decisions. Stringent tobacco control measures, including taxation, advertising restrictions, and smoke-free policies, contribute to reducing the prevalence of nicotine use. These policies create an environment less conducive to the initiation and maintenance of smoking habits. Tailored smoking cessation programs provide support for individuals attempting to quit. These programs often incorporate behavioral counseling, pharmacotherapy, and peer support to address the multifaceted aspects of nicotine addiction. Harm reduction approaches, such as the use of nicotine replacement therapy, NRT, and electronic cigarettes, e-cigarettes, aim to provide safer alternatives for individuals unable to quit nicotine use entirely. However, the long-term safety and efficacy of these approaches remain subjects of ongoing research and debate. Challenges and future directions, navigating the path ahead. The landscape of nicotine-containing products is evolving with the emergence of novel devices and alternative nicotine delivery systems. Dual use, wherein individuals simultaneously use multiple forms of nicotine, poses challenges for public health efforts. Nicotine addiction disproportionately affects certain populations, including individuals with lower socioeconomic status and those with mental health disorders. Addressing these disparities requires targeted interventions and a comprehensive understanding of the underlying social determinants. Continued research into the neurobiology of nicotine addiction, the efficacy of cessation interventions, and the impact of emerging products is essential. Innovations in treatment modalities and prevention strategies can contribute to more effective outcomes. Given the global nature of nicotine addiction, collaboration on an international scale is crucial. Sharing best practices, coordinating research efforts, and implementing evidence-based policies contribute to a unified approach in addressing this public health challenge. Nicotine addiction, driven by the allure of pleasure and the physiological effects of this potent substance, remains a formidable public health concern. Understanding the intricate interplay of chemical, physiological, social, and psychological factors is essential for developing comprehensive strategies for prevention, intervention, and cessation. As society grapples with the challenges posed by nicotine addiction, a collective effort involving individuals, communities, healthcare professionals, policymakers, and researchers is imperative. By prioritizing education, implementing evidence-based policies, and fostering a supportive environment for those seeking to break free from nicotine dependence, we can work towards a future where the cycle of addiction is progressively dismantled and the health and well-being of individuals are safeguarded.
Thank you very much. If you are new to our channel, hit the subscribe button. To receive notifications, click on the bell button. May God bless you all.